I'm Mark from Livewell Cpap, and I'm going to go over the Airsense 10 today. And I'm going to go over it and maybe pause in between so you can follow along and follow on your machine so you understand kind of what's going on here and some of the things you can do with the machine. First thing I'm going to do is I'm going to go over your basic startup, what to do just to get going on your machine. And it doesn't have to be too complicated, but it can be as in-depth as you want it to be. Second thing that we'll go over is the cleaning and maintenance on here. Third thing we'll talk about is the humidification, because the humidification can be kind of tricky in getting you comfortable, but keeping a lot of water buildup out of the tubing. And then the third thing we'll go over is the menus in the machine. And talk about what you can look at, etc. Now, on the machine, so basic startup is going to be this button right here is going to start it. And it's a toggle. It looks like one side says start, one side says stop, but it's just once turns it on, once turns it off. I'm going to turn it on. I'm holding my hand over the tube so it's not quite so loud. Just going to turn on there. You'll notice it starts up and you have your humidity settings here where your doctor prescribed there, and then you'll notice your machine goes dark after a bit. If you want to wake it back up, and this goes if the pressure's not on as well, just press this button here. It's going to wake it back up and you can see the screen again. Of course, in the big circle is where your pressure is at currently. And then once shuts it off. When you do shut the machine off, it's going to give you just a quick snapshot of how you did. It's got usage hours on there, and that can be important because insurances may stop paying for your machine if you're not using it. Second piece down there is events per hour. So typically we're trying to get that less than 5, but your doctor will help you get those pressures dialed in to get that in the right spot there. And then on the bottom, and again, I'll wake it back up here, it's going to tell you how well your mask sealed and how well your humidifier worked. To start up, you want to fill the humidifier with water. If you grab right here and pull, it's going to come out. Right on the side here, if you lift up, it's going to come up there. Fill this with distilled water. Just fill it up to that max line. And you'll probably want to do that every night, just depending on where your humidity and settings and your pressure settings are. But that's just going to snap in place. Make sure to get it all the way in. If you don't, it will sound like it's leaking. Snap it in place there. Next part is your tubing. So if you squeeze right here, this is going to come out. You've got a little electrical connection right there to get that in place. And of course, this side is going to be the mask. As you saw, this side is very specifically to the Cpap machine. You'll just click in place and then it will swivel from side to side there. And of course, plug that in when you're ready to put your mask in there. And of course, the mask just goes in this piece. Right here on the side is your filter. We'll go over that in just a little bit and the cleaning and maintenance. But that's all you have to do to really get up and going with your machine. Again, once it just starts it up, it's going. You can hear it going there. Once we'll stop it. Next part we'll talk a little bit about is the cleaning and maintenance. We'll kind of go over all these parts again. But as far as the cleaning goes, on the side you have an air intake filter, because really this is an air pump. This will pop open. There's a little notch on the back of that, which will bring that door open. If you grab and pull, this will pop up. Check this filter every 2 weeks. If it looks dirty, throw it away, put a new one in there. It's like your furnace filter at home. If it looks gross, it is, chuck it. I do, now this is one from the manufacturer, but I send everybody home with hypoallergenic filters just because they catch more stuff. I've seen a lot of Cpaps on the market after a couple years get really a lot of dust in there if they're using the manufacturer's filters, and it'll kind of make them whiny just because of the dust buildup in there. Next piece will stay back here, actually, is your tubing. And as I showed you before, you just squeeze right here. It's going to come out. And the easiest way that I found to clean this out is just put a squeeze of dish soap right in here. And then this fits just about perfectly on a sink faucet. If you wiggle it on there, turn the faucet on, and the water pressure flushes that tube pretty well. Now the manufacturer says to do that daily. If that seems to be a little much, what I might recommend is doing it just once a week. You can get this electrical connection wet. Just make sure it air dries before you plug it in. If you feel like you want a little bit more germ fighting power, you can do a water vinegar solution. So 4 parts water, 1 part vinegar, and let this soak in there, or run that solution through the tube, and it's a good mild disinfectant. Again, it'll just kind of plug back in the back here. Same thing on the humidifier chamber. If you, they do recommend to wash it once a week. If you grab and pull, this will pop out. Right here again, it pops up. The manufacturer recommends to let this air dry every day, empty any excess water out, but wash it once a week, mild detergent. But you can also do that water vinegar solution to get a little bit of extra antibacterial power there.
Now we're going to talk about the menus on your Cpap. There's a couple of different menus. This is kind of your main screen that you'll see here. You've got 2 options. My options, as you can see, and then sleep report. When you hit stop, your sleep report pulls up automatically. And again, I think I've showed you this a couple of times, but I'm going to wake the machine back up here just by pressing the button. Let's go into the sleep report first. You'll notice as I twist it up and down, whatever's highlighted in blue is where you're going to get into. If I click on this, it's going to tell you, again, kind of that quick snapshot of how you did the previous night. But let's go farther down on this. You'll notice as I scroll down here, it moves that up. Right here, My Air, that's an app you can get for your machine. And usually we'll talk about that when we get you set up on your machine. And I can send you an invitation via email to get you that app if you prefer. Next piece here is a period, and you can change this if you click on it. You've got anywhere from a day clear to a year, and this is going to give you a bunch of different clinical data below this. As we scroll down, usage data on here, and again, this will help with your usage and your compliance for insurance. Pressure. We know the pressure right now, I've got this set from a 6 to 16, but this is going to give us the 95th percentile pressure. So if you're on an auto set, that can vary on what that pressure is. Next one down is your leak. So above we had a smiley frowny face on the seal, but this tells us how many liters per minute leak exactly, and typically we want to keep that below 24 liters a minute. Next one down is your AHI, and that's how many events per hour you have. But if I scroll down, it splits it out into multiple different parts of that AHI, so what types of events you're having. And we're at the bottom there, so if I press the home button, we're back out. Now let's go into the My Options menu. If you click on it, you've got your ramp time. So that's how long it's going to take to go from a lower pressure to a higher pressure. And you can twist that, click that on. It goes in 5-minute increments. And can go to auto. So let's say, for example, you're starting out at a pressure of 6, but you want to start out at a pressure of 5 and have it take 10 minutes to work up to the 6. That's what the ramp would be for. And that's a comfort setting for you. Feel free to change that where you need to be. Humidity settings, we'll go over those in just a little bit because that can be a little tricky in finding the right humidity settings for you. As we scroll down, Smart Start, usually I leave that off. So the theory behind Smart Start is when you breathe into the machine, it should start up by itself. And sometimes it works really well, sometimes it can be quirky. So usually I'll leave that off to start out with, but feel free to turn it on. Again, you just highlight anything here, Click on it. Go wherever you want it to go here. I'm going to turn it on for just showing you sake. And then next one down is the type of mask you're using. So that mask right now is set to pillows, but you have 3 options. You've got nasal, full face, and pillows. And that's mostly for intentional leaks. So kind of what I see on my end as far as the reports go. If you don't have that in the right mask, it's not going to harm your therapy a lot. It doesn't change it a lot. Run mask fit function. What that does is it gives you let me go back to the 6 to 16 settings. Let's say you start your mask out at a 6, or start your pressure at a 6, and you've got your mask set to a pressure of 6. Well, a lot of times as your pressure goes up, as your airway closes off, let's say it goes up to a 10, sometimes that mask, it's fit for a 6, sometimes it may start to leak for a 10. So if you do a run mask fit function here, and you'll hear the tube go, and you'll see it go frowny for just a minute. But the advantage of it's going to give you a blast at your 95th percentile pressure. So let's say that was a 10, it gives you a blast at a 10 here, so you can snug the mask down at a 10. And then you can just deselect that, and then that would be afterwards you just hit your start button if you want to start your therapy. So that can be very helpful if you have a wide range of auto, or if you're a patient with facial hair. Sometimes that can get a little tricky as well, but that'll tell you how well you're sealed up. Run warm-up is something you can use, but you don't have to. What it does is it starts warming the humidifier before you turn your pressure on. So the advantage of this is the first little bit of therapy you get is a lot more humidified. Now you don't have to use this, because anytime your machine is running, your pressure's on, your humidifier is also warming. But I do use this function if I'm ever dealing with any sinus issues or allergies. It helps just clear those up. Next, we've got airplane mode on there. I'd always leave that off. The advantage of that, or what that does, is it's going to leave your modem on. So it's a lot like your cell phone. If your airplane mode is on, your phone won't call out. So I'd always leave that airplane mode off. And then the last one is about, and that's software versions, serial number stuff you don't have a lot of, you probably won't care too much about. Kind of more for manufacturer and your company. Then I'm going to go back here. Now I'm going to scroll up to your humidity settings here. And so with the humidity settings, and I say humidity setting, it's climate control is the way the manufacturer sets that. But if I click on that, you have an option for auto, and then your tube temperature can be auto as well. So the advantage of auto on the climate control is it's going to help keep condensation out of the tubing. Condensation is not generally dangerous, but it can be really obnoxious. If you go to sleep and you wake up 2-3 hours into your therapy, you may hear some gurgling and popping. It sounds a lot like a coffee maker making coffee, something to that effect. So the advantage of auto is it's going to keep condensation out of the tubing. Typically around 65 degrees of room temperature is where I see this being beneficial typically. So if your room is cooler, is 65 or cooler, I'd usually leave that on auto, and it just is going to help you keep condensation out of the tubing. If it is warmer than 65 degrees, you can set this to manual. And the advantage of manual is you have more flexibility in your humidity settings. Now you notice I put it on manual, and you have the tube temperature, which you can change. And if this is set to manual, the climate control, the tube temperature is to help you keep condensation out of the tubing. And then the humidity level, you notice I can go anywhere from a 0 to an 8. Humidity level is how hot this heating plate gets. So the hotter that heating plate gets, the faster the evaporation rate. And then again, that's more humidity for you. In the tube temperature is just going to keep condensation out of that tubing. So if you're getting dry, I would increase the humidity level. You can go clear up to an 8 if you want. But if you start to get water in the tubing, go up on the tube temperature. For a lot of folks, it's a little counterintuitive. But if you go up on humidity, also do maybe a degree or 2 on your tube temperature, just to keep the water out of the tubing. That's basically it for the Airsense 10. Feel free to look through these videos and follow along and kind of go over these things. Thank you very much.